Welcome to the Indiana Athletic Trainers Association podcast. The IATA is dedicated to advancing the profession of athletic training and empowering membership through advocacy, education, networking, and innovative resources. To find out more about the IATA, check out our website and social media pages. The views and opinions expressed by speakers, guests, or others who have provided materials to and for this podcast are not necessarily those of the IATA. The IATA assumes no responsibility for nor endorses any of the comments, recommendations, or materials that are provided. Hi, everybody. Welcome back to the IATA podcast. My name is Daniel Welty. I'm the host of this episode, and I am really excited to have two wonderful guests and two people you probably recognize. And we're here today to talk about the 2025 IATA Annual Symposium. And I am happy to have both Kathy and Vince, who are co-chairs of the Professional Development Committee of the IATA. Welcome, Kathy and Vince.
Thank you for having us.
Thank you, Dan. Yes.
Well, first off, again, you guys are no strangers to the IATA, and but I do want to give you guys the opportunity to introduce yourselves. And so, Kathy, if you want to get started introducing yourself.
I'm Kathy Remsburg. I have been a member of IATA since 1990, so a long time, since I moved to Indiana. I've worked at Franklin College for that same amount of time, running being a head athletic trainer and then running the undergraduate program and now teaching in our Masters of Athletic Training program. And I've been secretary of IATA and now Professional Development Committee.
And Vince, would you like to introduce yourself here?
Yes. Hi, I'm Vince Stilger, and my association with the IATA is a little bit strange. I was actually a charter member of the IATA back in 1983 when I was at St. Joseph's College, and then I went to Indiana State University for 5.5 years, and I went to IU and got my doctorate from 90 to 93, and then from 94 to 2018, I worked at West Virginia University as program director. And but I also had my hands involved clinically for about 20 years with WVU football and about 3 or 4 years with WVU baseball. And I moved back to Indiana in 2018. I basically retired from the college level. I work part-time now as an athletic trainer at my alma mater high school, Lanesville High School in Southern Indiana. And so I've been back in the state since 2018. And then Kathy and I took over this as co-chairs about a year ago, I believe. And but I was involved with the education committee, other committees, the IETA when I was in the state, and I tried to be as active as I could, and still continue to try to give back whatever in some capacity.
Yeah, I appreciate both of you coming on and talking a little bit about the symposium. And so, let people know as far as let's start with kind of when the symposium is, where it's at, and kind of that kind of information as we kind of get rolling here.
Daniel, the symposium. Oh, go ahead, Kath.
No, you go ahead.
Go ahead, Kath.
No, you go.
Okay, the symposium is June the 8th at Forte Sports Medicine Clinic in Carmel, Indiana. It's actually at the same location that we were at last year. And it actually registration is from 7:30 to 8:15, and first speakers are at 8:15, and it actually goes till about 4 o'clock is when it'll wrap up.
With the break for lunch.
Absolutely, gotta have that break for lunch.
Gotta have lunch.
Yeah,
And then
we also have we have a break in the morning for 15 minutes, and we have a break in the afternoon also for 15 minutes. So basically, with the presenters, each speaker slot, Daniel, is an hour and a half, 90 minutes, and go to a break, and then another speaker slot for 90 minutes, go to lunch, and then after lunch, at 12:30, the second or the afternoon session would begin. 90-minute session, and then another 15-minute break. And then the last speakers are scheduled from 2:15 to 3:45.
Yeah. And what is the cost for a a certified or a licensed member? What is the cost and how many CEUs is this symposium?
The cost is 125 for early bird membership that goes until the end of May, right, Vinny?
Yes.
Yep. And then after that, it's 150 for a member. And then for Hall of Fame members, it's $50.
Yes. And a couple other categories, as well is IATA non-members is $165 early registration, and that also is to May 31st, and then $190 for that afterwards. And there's several different categories for student membership: student, non-members, student certified, student non-certified, and those prices can range from $25 to $75, just depending where you fall in that category in terms of your membership.
And how many CEUs will people get if, as a regular member, I'm paying $125. Well, how many CEUs is part of this symposium?
There's a total of 6 CEUs, Daniel, for attending this state symposium, Junior. So 6 CEUs.
CEUs, perfect.
And this is a reporting year, by the way.
Yeah.
That's a good reminder for myself as well.
Yes, yes, indeed.
So, one of the things that I think a lot of people do when they're looking at symposiums is they're looking at the value, right? And so they're kind of looking at what am I taking away as far as if I'm paying a cost, what's the value in the symposium, right? And a lot of people try to do the quick math of like, okay, number of CEUs versus the cost, right? And when you break that down, the number of CEUs, but there's so much more to a symposium than just the CEUs. And so can you expand on a little bit maybe about whether it be the meals or networking or whatever you want to expand on about the value that this IATA symposium brings to those that attend?
Well, I know last year, our predecessors came up with a wonderful idea as far as doing a lot of hands-on labs as part of the symposium, as opposed to the normal content and speaker. And it went over very well. And so we piggybacked off of their wonderful idea, and we are doing that again. And we feel that athletic training being such a hands-on profession, it requires a lot of hands-on skills and techniques to learn, and there's always new skills and techniques to learn within athletic training. So we focused again on the hands-on aspect and tried to focus on those skills that we thought that any athletic trainer, no matter what setting that they might be in, will be able to take at least a couple things away from it.
And I might add to that as well, Daniel, that the feedback from last year's symposium really stressed, and they really enjoyed and liked the hands-on that they got with the symposium last year. And so, like Kathy said, we want to just continue to go with that. And she couldn't have said it any better in terms of hands-on skill and so forth. But I think with this hands-on learning lab type of things, number one, I think it allows you to be able to interact a little bit more with the speaker in terms of they do a demonstration and a technique, and then you have partner up and you practice it. So it may be the speaker, and it may be a couple others that are assisting the speaker, and they'll walk around the lab area, the learning lab area. So you have a chance to interact, and okay, whether it be you're asking, okay, is my hand placement correct here? And what is the best type of situation that you utilize this for? And so you can get, in a normal lecture setting, you probably can't get that type of feedback and interaction. It allows you to network closely. You can meet new people right away when you split up in terms of a group of 4 or a group of 2. Maybe one of those individuals that you're working with has used this technique before, and they say, I really find that it's very beneficial for this or this or this, in addition to what the speaker has talked about. So I just think there's there's quite a bit more opportunities in terms with the Learning Lab that you don't really get a straight lecture presentation and so forth. And I just think those are some of the benefits that you can reap from that as well.
And kind of to piggyback off of what Vince said, the classes themselves, like the number of participants in each of the learning labs, is small. So there will be a cap on each of the learning labs. And so that allows that more one-on-one interaction with other participants, with the speaker, to be able to get that feedback that you mentioned. So note to self, once you look at the all the speaker presentations, you need to get registered ASAP for the summer symposium, so you get the hands-on learning lab that you want before it gets closed because it fills up.
And I will add to that as well, Daniel, that there is an overall cap on the registration, and I think that's at 120, if I'm not mistaken. Kath, is that right?
Yes.
Yeah.
Yep. So obviously, those listening in, make sure you're signing up early and quickly to secure your sessions that you want to go to, like Kathy said, and obviously there's a cap to the entire symposium. So make sure you register early, otherwise, and a lot of it's due to space and also trying to keep those learning labs to a manageable size for the speakers. So they have time to do what Vince is talking about, is have that interaction, and that you, the attendee, also can have that interaction with the speaker, and actually take some valuable skills away from the symposium and apply them to your practice. I saw on the website the Learn Today, Apply Tomorrow theming of continuing to make sure that the IATA is continuing to provide its membership with best practices, updated techniques, and those types of things. So I'm glad to see that. And is breakfast and lunch included in that price? Is that correct?
Lunch for sure is included. Breakfast, there will be like coffee and some fruit, very basic breakfast stuff, but the lunch for sure will be included.
Good.
Yes.
But definitely have coffee, because we heard feedback that people were not pleased about not having coffee last year.
So you heard.
Pardon?
Go ahead.
I was going to say, and if I remember right, I think registration closed last year. Like there was people on a wait list to get in, if I remember correctly.
I think that is correct, Kath. Yeah. Yeah.
So what were you going to say about the coffee, Daniel?
Well, I was just saying I'm glad there's going to be coffee, and I heard the same comments there. So, but I want to kind of dive a little bit into the schedule here, and we can kind of just start. The first session starts at 8:15, but make sure you get there early if you're signing up for the symposium, and just make sure you can get signed up, get registered, get yourself familiarized with the facility and where you need to go. But 8:15 is the start time of the first learning labs. And I want to say too, as I was looking at the sessions, obviously there's choices for people. It's not like you're going to have to be stuck in one unless a class gets filled up. But you do have some choices here. So at 8:15, we can kind of just work through the schedule here. So if you guys want to talk about the first two learning labs at 8:15.
Sure, I can talk about those briefly. All right, at 8:15, the first one is Don't Strain About Strained Muscles, an exploration of novel treatment techniques. And then also the concurrent session is P&F, facilitatory strengthening techniques for the upper extremity. All right. So obviously, the first one there is talking about a different approach in terms of how to treat strained muscles and some of the techniques that they've utilized and they've researched and have come up with that are a little bit different in terms of that. And then the other concurrent session is focusing just on PNF and strengthening for upper extremities, shoulder, elbow, wrist, fingers, and so forth. And that's and like I said, you have to register. You have to, I believe when you do register, you have to pick which concurrent session you would like to attend to. Now, I believe that they do fill up, they automatically overflow into the other session. So that's how that is set up, I believe. And then at 9:45, there is a break for 15 minutes. And then at 10 o'clock, we have two concurrent sessions again. And the first one is manual therapy, the shoulder complex. And I don't really remember, Daniel, what some of the different manual therapy techniques they specifically were going to get into. Kathy, do you recall what those were?
I don't. That was the one meeting I didn't attend. Or I was unable to attend,
Okay,
so I didn't hear about that one.
And then we have a concurrent one with that, the athletic trainer's role in concussion rehab. And there was what was the scale he was going to talk about? I'm going to say Buffalo scale. Is that right, Kathy?
Buffalo treadmill.
Do you remember?
Buffalo treadmill
Yes,
test.
yes. That Matt was going to talk a lot about in terms of that regard and return to play and so forth and how to utilize that. And so those were our two 10 o'clock sessions that will run concurrently as well for 90 minutes.
And then lunch.
And then, yes, sorry. And then lunch. We go to lunch for an hour. Okay, 11:30 to 12:30. All right, then at 12:30, we come back with two concurrents again. First one is a hands-on to diagnostic ultrasound and athletic training. Kathy, you've had some contact with that speaker. You can perhaps dwell on that or discuss that a little bit more.
So we will be using butterfly ultrasound units, and there will be an app that people can download on their phone. And through the app, you can see what you're doing with the diagnostic ultrasound. So you'll be able to see muscles and tendons and blood flow and organs, and it's really very interesting. And these butterfly units are very affordable, so athletic trainers who are interested in possibly using diagnostic ultrasound to help in their clinics, in their athletic training rooms, it is something that they could consider.
And that concurrent session, also too, Kathy, I think you had a lot to do with this speaker. And that topic is concussion intervention from assessment findings to advanced rehabilitation.
Yes.
And that's
so
Stacey Gavin.
Yeah, so this session will focus on the VOMs and doing specific rehab techniques associated with return from concussions. So people who are struggling with maybe like post-concussive syndrome, or people who have lengthy signs and symptoms, they might struggle as far as their balance and their eye movements and being able to move their head from side to side without the return of symptoms. And so that Stacey will be talking a lot about the rehab aspect and the VOMs on the return to play. I've heard her speak on this and she's wonderful.
All right, and that's then at 2 o'clock, we have a 15-minute break again. And then our last speaker slot for the day, Daniel, begins at 2:15. And those concurrent ones, the first one is best practices for instrument-assisted soft tissue mobilization techniques. And that is Adam Thompson. And I think he's going to look at maybe A-stem, maybe some, I don't know if it's grassing or just some scraping in general. And I don't know if cupping is involved with that, but those are just some of the things I know that were thrown out perhaps with Adam's presentation as well. And then
Everybody uses that, but I feel like this talk will go behind the whys of using it and when is best to use it and how it's best used and that kind of thing.
and then the last presenter at that same time is a neuromuscular approach to relieve shin pain, and Kitty Newsham and Christine Lauber. And honestly, Daniel, I don't know anything about that presentation or I didn't see the abstract. Well, I saw it, but it's been so long ago and so forth. So, but Christine used to be the chairperson of this committee, and so I'm sure she's got a great grasp and concept of how to do that in terms of hands-on delivery to the audience and so forth. So, but I'm really not aware of what her content is in this presentation.
Anything to learn to keep
Kathy?
away shin splints is wonderful.
Yes, yes. And I do want to mention as well, Daniel, well, let me just, after that, there's a brief closing remarks, and basically the symposium is over by 4 p.m. So registration early. If you're a walk-in, pre-register, walk-in on site or pre-registered, that's from 7:30 to 8:15, and our closing remarks then will be from 3:45 to 4 o'clock. And I did want to mention, Daniel, and Kath, please feel free to interject with this, but basically the way we go about selecting speakers is we have a call to the membership for abstracts, probably went out in November. And so some of these abstracts that were presented to us, reviewed by Kathy and myself, and then also to our committee. And I want to mention our committee as well. We have Lewis Rush, we have Sarah Rowe and Kaylin Condry, and they were on the committee last year as well. And so they've been a great resource for us and kind of a guiding light on how to steer through this whole process. But yes, we had a call for abstracts, speaker abstracts, presentations back in November that was sent to the membership, and probably, I'm going to say maybe half of these speakers we got through abstract presentations. And then we as a committee then had to then put our heads together and throw out what we thought were viable topics, but yet also trying to keep in mind what the membership told us last year on their evaluations and what they would like to see and so forth. So in that regard, then we would go out and try to utilize our contacts and so forth and get speakers with those topics, and then fill in the rest of the program and the agenda in that regard.
And anybody who attends the meeting will receive a link to fill out a survey. And we strongly encourage everybody to do that, because that is the feedback that we get on what you liked and what you didn't like, why we need coffee. And so we utilize that information from that survey to help improve it for the following year.
And that does help us immensely. It really does.
And as you were talking about, obviously the symposium, and I was just thinking about all the topics there, and obviously learning labs, which requires the hands-on, but a lot of, I saw manual therapy in the morning, and then with Adam talking about soft tissue mobilization. But one thing that stood out to me was a couple of concussion rehabilitation courses, and even one that says advanced rehabilitation. Didn't know if that was maybe some things on the survey that people were wanting with some concussion rehabilitation, or maybe that your committee thought this is something that a lot of athletic trainers maybe want. So I didn't know if you could expand on any of the, since I saw two concussion things, I thought I might ask. So
it was a little bit of both. People mentioned that they wanted some concussion talks. but also um, concussion rehab and concussion evaluation is forever, like always ever changing. And all the latest research says that they want you to be active more quickly. And so we figured because of that, maybe people would be interested in hearing about what that rehab looks like and how it has changed maybe from when they learned it in school.
And to expand on that, what Kathy just talked about, Daniel, we wanted to be, we really tried to make sure that we weren't getting a lot of repeat information in these two
Mhm.
presentations. And Lewis, one of our committee members, was very good about it because he knows Matt Campbell and was able to get Matt Campbell to speak. And I think Kathy knows Stacy Gavin. But Lewis was able to put both Matt and Stacy in contact with each other. And they were able to talk about what their presentations were, where they're going to, what they were going to focus upon, and so forth. And just so there wouldn't be a lot of overlap with their presentation. So I think membership, when they look at that, they have to take into consideration that there is going to be new information and viable information from each one of these two presentations that they could take
Mhm.
back with them and use in their specific clinical setting.
Yeah, and that's so great to hear that obviously there's the communication among that and your committee doing a great job to recruit great speakers, but also have that great content as well. Because obviously I'm sure that you and your committee feel strongly that we need to provide our membership the best skills possible. And like Kathy, you were saying, it's like things change all the time, especially in concussions and the way we
Mhm.
manage and the way that, I mean, you guys have seen it over, I'm sure, the course of your careers on management of concussions. The way we used to do it
Yes.
30 years ago to today
Yeah.
is, dramatically different. Right. And so I think it's as a member myself of the IAT, I appreciate the work that you guys do that and didn't have to do that to connect two speakers together, but a simple conversation makes that symposium that all that much better. Especially if I'm very interested, or somebody out there that is very interested in concussions or manual therapy or whatever the courses is, that you're going to get some high quality content, but able to actually apply it hands on, at the symposium.
Mhm.
Right.
And since these, I think most people, when they come to a symposium, a lot of times it's, a suit and tie type of thing or a nice blouse or something in that nature. And with these being learning labs, I wonder if I should be wearing a suit and tie or if I should be wearing some lab clothes. What's the best attire for this symposium?
Casual lab attire. Definitely not suit and tie because you're going to be moving around. You're going to be getting ultrasound gel on you if you're doing the diagnostic ultrasound one. You're going to be getting up and doing different exercises with PNF. So definitely wear comfortable, suitable but comfortable clothes.
And I think to expand on what Kathy just said, but with Kathy and I being program directors for many years, um, we stress to our students professionalism, particularly when they attend a professional meeting. But Kathy's exactly right. You can still dress professionally, but do it as comfortably as you possibly can because you're going to be involved with what's going on in terms of those sessions.
Yeah. And I think one of the reasons that, usually was stressed so highly, to students and that you've educated over the years that, to dress in professional attires because over the years, symposiums have changed, and definitely the IATA annual symposium has changed as our education has changed over the years, and technology has gotten easier for people to do lecture-based, you know, um, sessions online, kind of in your pajamas at home, right, at your own speed on your own time. And so this provides people that. But a little bit of too is that, the IAT has also shifted some things as far as the annual business meeting is now a virtual option, making it easier for membership, as well as the honors and awards ceremony is at a different time. So this symposium, we used to pack a lot in one, or back in the day, IATA used to be 1.5, 2 day type of thing. And so some of the things have shifted over the years. So if you haven't attended a symposium in a while with the IATA, a little bit different feel to it. But I think what you guys were saying, that the feedback seemed to support the hands-on skills that are wanted by our membership.
Mhm. Yes, it was very
Right.
overwhelmingly positive on how well the symposium went last year with the hands-on aspect. So we just were able to continue that. You mentioned the
And
awards.
to, um, yes,
Oh, yeah, the awards is going to be the night before. It is the awards banquet is not on the day of the symposium. It will be the night before at, I don't remember the name of the place.
I
It's the
think
same
it's the
one it
same
was last
location.
year.
Yeah, and I don't remember what that location was.
Do you remember,
And
Daniel?
then
No, I do not remember, but IATA members will and should receive communication in regards
Yes.
to that. So
yeah,
just make sure you're checking your
yeah,
emails and social media about the details of that event. So, and
Yeah.
obviously,
and then,
looking forward to honoring some great athletic trainers. So,
Yes.
then I think the business meeting is a Zoom meeting again, which is probably in July or August, I believe. But that hasn't been announced, but I know that's what they've done the past few years.
yeah. Yeah. So that's nice to be able to kind of separate some of this. And obviously as co-chairs, I'm sure it's nice also to kind of be like, okay, now we don't have to be on time on certain things, right? You know, when you had back in the day, I remember the business meeting used to be during lunchtime, and it was how do we make sure we get
Yes.
this all in and make sure people eat and not feel rushed. And but I
Right.
think that's what I do like about that is now lunch is a little bit more chill, and especially now people are going to be working up a sweat with the learning labs. You know, it's kind of like gives you kind of a nice break, get rehydrated and get your carbs in and get back out there. So
Yeah.
There
I
you
like
go.
that
There you go.
we can, each of the things could be the central focus now. So like the business meeting could be a central focus, the symposium could be a central focus, the awards could be a central focus. So everybody gets their, you know, instead of trying to cram it all in, like you said, I think it works very well that way.
yeah.
Daniel, I wanted to mention too, there are going to be exhibitors, but right now we don't really have a hand in that, but there will be exhibitors, to my knowledge, that will be present. Kath, do you know for sure if any of them have confirmed?
We have not heard from him yet on that,
Okay, all right. And I
to my
think
knowledge.
is that it's who?
Um,
That Matt Harmon?
yes.
Okay. Um, so yeah, but there will be exhibitors, and so we obviously would encourage the membership that are present for the symposium that day, the morning break, the afternoon break, lunch break, to stop by and interact and talk with the exhibitors as well.
And I know every year there's always at least a handful, if not a couple handfuls, of exhibitors that do come
Yes.
each year, and sometimes it's the faithful ones that come every year and help support the IATA and are sponsors and supporters of what we do as athletic trainers, and then we usually get some other people that come and are exhibiting and those types of things. But obviously, it's always good to talk with exhibitors because they're either helping supply, you know, some of you athletic trainers out there that are getting supplies and having to do all that process, right? They're going to be maybe your potential reps or contacts within that, or maybe you need a new product for something and now you have their contact information or at least a familiar face, especially when you're emailing somebody. That's always nice to remember somebody's face when you're emailing versus a random email that goes out and then you finally run into each other and at a symposium and then you're like, oh, that's what you look like.
Yep.
Uh,
Yeah.
so,
Yeah, and I know we've talked about a lot about the hands-on experience and so my question to you guys is why learning labs, right? Typical, symposium fashion is to have more of a lecture-based um, sessions where I can sit and relax and sit in the back and play on my phone. Did I say that out loud? I didn't mean to. Uh, but why learning labs?
Well,
Why do you think it's so valuable that we provide that to the attendees that attend?
well, let me just, obviously, if we go back 5 years ago to COVID and how we went about getting CEUs, and because of COVID and basically the online CEU became very, very popular. And so I kind of feel that since then, technology has made us lazy in terms of how we go about acquiring our CEUs and so forth. And people don't any longer want to go to state meetings or district meetings or the national meeting, because I know it's not only at the state meeting, but it's all throughout the country where the numbers are very much have decreased in that regard. Um, so I think going back to some of the things that I'd mentioned earlier, it's just, Kathy said, athletic training is very much a hands-on, a skill-oriented type of profession. And the things that we do are constantly changing, or whether they're being upgraded, techniques are changing. A technique is perhaps becoming more specialized. So for us to do that in a group setting, I just feel that because most of us anyway are visual hands-on type of learners. Most students are, and even athletic trainers as a whole. And so I think that type of format has just been so well received by those that have attended that we wanted to continue to go this route. And to be honest, I would be surprised if the feedback is any different this year from what it's been in the past. I anticipate that we're going to have good positive feedback from the fact that everything is hands-on learning labs. So that's my take on it. Kath, I'm sure you have something to add to that as
Yeah,
well.
I mean, the students, if you ask them why they go into athletic training, it's because it's hands-on and they get to work with athletes and active individuals. And so they want the hands-on aspect is first and foremost. And the majority of them, that's how they learn best. And so to do hands-on techniques that maybe, I'm still involved in an educational program, and we cram so much in the 2 years now that they are within the program that it's hard to teach them a lot of these manual therapy techniques and actually learn them and be able to have the time for them to practice them and everything, because there's just not a lot of time because there's so many other standards and everything else we have to meet. So the opportunity once they get out from the school to do the manual therapy techniques that are becoming kind of the thing and the go-to now to learn, I think is a wonderful opportunity for the younger athletic trainers to gain new skills and the older athletic trainers to maybe learn them too, because we didn't learn them when I was in school. And, manual therapy wasn't I don't know about you, Vinny, but manual therapy wasn't a thing.
No, no,
when we were
not
in
at all.
school. And so, within the classes that I teach, I can even take away stuff, not that I'm working as an athletic trainer other than PRN, but there's skills that I can teach the students and actually try to help them learn it a little bit. And then they can come to a learning lab and expand on that learning.
Yeah. And I think that's a great point, Kathy, as far as like, obviously this is not meant for just one age group or just one setting. I mean, this is a symposium that you can take anything away from this and apply it to your patient
Mm-hmm.
populations. Everything is a little bit varied here and there. That's just based upon our settings. But I think what you're saying is that it's all valuable information and that we can always grow and sometimes when you hear something over and over, but sometimes it's nice to hear a speaker talk about it in a different fashion too, in a different
Mm-hmm.
way to kind of make the light bulb go off. I've been in sessions before and they say something different. I'm like, oh, I've always said it this way, but that's a better way to say it and think about it, and then it starts clicking and while things maybe, hey, maybe that's why it wasn't working in my practice before, maybe because I just needed to change up the technique just a little bit, and maybe that would have been the successful thing. So I think you can always learn something new,
Mm-hmm.
and you can teach old dog new tricks.
Yes, you can.
It,
Happens every day.
And speaking
Kathy, I
on
think he just called us old.
I think he did too. Yes, I agree.
maybe a little, maybe
That's okay.
not.
We're used to it. And we are.
Oh, my
Well,
students call me old all the time, so
well,
Yeah,
speaking of
my athletes here, Daniel, call me grandpa, so I just laugh.
well, speaking to a couple of veteran athletic
there we
trainers,
go. I
there
like
you
that
go.
better.
I was kind of thinking of a question as you were both talking there. Maybe take us back, 30 years, and talk about education programs in the past, because you both have seen education and have been involved in some different things, obviously being educators. Talk a little bit about, how education has changed over the years for athletic trainers, or maybe something that you thought what we're doing today, you never thought we would be doing back then, and kind of some surprises, some little bit of things that hopefully that question made sense, kind of
Mhm.
over time, what has changed and what surprised you maybe.
I mean, when I got into athletic training as a female, I was definitely the minority. I mean, definitely the minority. And now the majority are females. So that has changed. Females in the professional setting, I love it. Very excited to see that, and it's in almost every professional setting now that there are female athletic trainers. But I came up through when it was a internship program. But I didn't come through an accredited program, and I did it at the master's level for that internship program. So that has definitely changed. And I remember starting at Franklin College, and they said, "Oh, let's get students involved and let's maybe work towards starting a major." So I was teaching the students everything in 2 classes, like total. And then I made them do in
Wow.
services. So I made them come to do in services to do some additional things. And then I was really excited when we moved to the uh, accredited type program, because it was much more standardized as far as the learning, because the way we were doing it before, it was hit or miss. I mean, if you were there and you happened to learn something on site, great, but then no, but not all of the students were there. So in that regards, it has definitely changed a lot. And then the master's program piggybacked off of the undergraduate program. It's just now in a shortened form, very much more condensed.
As you're talking about that, Kath, and I'm just thinking of how the whole accreditation process has changed over the years. And it was first the JRCAT, which is a Joint
Yes.
Review
Yeah,
Committee
I remember
on
that.
Athletic Training. Programs at the time were approved programs. All right. And then it went to CAHEP,
Mhm.
CAAHEP, which was Commission on Accreditation of Allied Health Education Programs. All right. And then from CAHEP, it went to what it is currently CATI today, where everything is accredited. But I remember some of the things starting out with students in my last 2 years at Indiana State, which was 88 through 90. We would send undergrad students, Daniel, with the team on the road,
Oh yeah, by
unsupervised.
themselves. Oh
And
yeah.
that and students would put in, if you worked football in the fall at WVU, and there was no hourly limit whatsoever, our kids would put in 1,000 hours. And that's counting 2 weeks of double sessions before classes began, and then going pretty much 6 or 7 days a week. And there was no limit on the number of hours. And then that changed to 20 hours. And then it changed to where students had to be supervised. They couldn't go on the road by themselves. And I remember that upset a lot of people, and particularly our students, because they talked about how that was such a great learning environment for them to have to make a decision on their own. And I could see pros and cons of that. Internship programs, Kathy, there's so many people that probably aren't even aware of what that is today.
Yeah.
But basically what it was, Daniel, you took 7 basic courses. anatomy, physiology, basic, advanced athletic training, first aid, kinesiology, and maybe another class. And then you got 15, and then you accumulated 1,500
1,500
on-site
hours.
clinical hours. And then that made you eligible to sit for the BOC exam. So just the profession as a whole, and the endorsements by physicians and so forth that has given this transformation to programs over the years. Obviously, it's become a very much a theoretical based program, but there's still so much skill involvement with it as well. And so I think that kind of comes back to why we need and are looking to do such a skills hands-on type of program. But yes, it is. And just even the techniques today, like manual therapy, there was no such thing as manual therapy when I was a student, or even early on professionally in my career. You know, our modalities were nothing like what we have at our disposal today in terms of trying to get an athlete back. I mean, now you can use a laser in the athletic training room, and I heard a new one today. It's called the newbie E-stem unit that I'm not really familiar with, but one of the local PTs has used it and really likes it. So technology has also changed and helped athletic training grow as a profession in terms of trying to treat our athletes and get them back to that pre-injury level of fitness as quick as we can.
Another big thing that has changed is how you take the BOC exam. It used to be a 3-part exam, and it took all day to do it. And you would be sitting in a big auditorium taking your written exam when they would call your name, and whoever came to get you, usually one of the athletic trainers, would come and then cart you from that. You'd leave your test there, and then you'd go to another room, and then you would do your oral exam. And you would have 3 people sitting there grading you with the stone faces, didn't crack a smile. You couldn't get any reading whether or not you were doing good or not. They had all the supplies out there, and it was a guessing game whether you were supposed to use them or you weren't supposed to use them. And then you go back to your test, your written test, and by now your mind's frazzled, and you had to try to finish up your written test. I remember I had like 30 minutes left when I got back, and I was like scrambling to try to finish it because I couldn't think straight. And then you took a break, and then you went and did this written sim that used you had a piece of paper with numbers beside it, and you would use this marker, and it came up with like it would highlight the invisible words in there that you would have to pick. And if you put your pen down just by accident on one of those little things, they counted it, even if you didn't want to do that yellow pen. I mean, yes, it was. They think this one is the online one is hard. No.
Oh, yes.
There's no comparison.
That's a great point. The exam has changed so much, Kath, so much.
Yeah. Yeah, I wouldn't wish that on anybody.
Well, I'm thankful that has changed over the years for myself.
Yes.
So that was good. So, well, that's really all the questions I had specifically about the symposium. Is there anything else that you guys wanted to add about this year's IATA annual symposium?
Registration's open. Everybody if you're a member, you should have received an email with a link to be able to register. So register early so you can get your first choices.
Good point, Kath.
And before we leave the podcast this year, I'm asking all of our guests on the podcast a fun question. And so whoever wants to take a stab at it first, but if you could be an animal,
Kathy will.
What animal would you be and why?
Gosh, I'd probably want to be a dog. Dogs have the best life, They just get to lay around and they get loved on and they get fed and they just get to play. They don't have to do anything hard, and everybody loves on them and makes your mental health better. So yeah, I think I'll be a dog, a fluffy dog.
I knew you were going to pick that, Kath.
How'd you know I was going to
Um,
pick that?
well, just you talk about your dogs all the time. I hear you talk about your dogs. So I was like,
Yeah.
she'll pick a dog.
Yeah.
And I was asking one of my athletes today, is he's about 1 month post-op ACL, and I asked him that question, and he says, I think I'd want to be a dog. And I said, why? He goes, well, they basically just have to eat, sleep, and poop, and that's about it. So, um, but that's not what I would say. I really have not ever had animals because I'm one of 10. I have 7 sisters and 2 brothers. And my mom and dad said we weren't having animals because we already have 10 of them. But but my wife likes animals. She has about 10,000 of them. And she's a beekeeper.
Oh, okay. I was like, oh, 10,000. I was trying to figure out what that would be.
Yeah, like 10,000 animals. But yeah, she's got 4 or 5 beehives. But I guess I would probably want to be a bird and probably a northern cardinal because I think it would be so cool to look up in a tree and just look down and see, okay, what's going on today, or to be able to fly and go from one spot to another. I just think flying, I think is pretty cool. But then you got to worry about hawks. So
And
I don't know. I guess
airplanes
I'd probably
and drones
a
and
northern cardinal.
yeah.
And I'm a big baseball fan, Cardinals fan, so I guess that's why I'm picking that too as well.
Boo, go Cubs.
Oh, geez. You just went down, Kath.
Oh, sorry. Just
I'm
like the
kidding.
Cubs, they go down.
Yeah.
Well, before there's a fist fight here over Zoom, I do appreciate both of you coming onto the podcast and talking this evening.
Wait a minute, Daniel. Wait a minute. You didn't tell us what
Yeah.
animal you'd like to be.
Oh, I knew somebody was going to ask me that at some point when I've been asking these guests, like, what animal would you be and why? And I was going to save it for the end of the
Yeah.
year, but since you asked, I would be a Rocky Mountain elk. That is my favorite.
Oh.
That is my favorite animal.
Okay.
I just think it's amazing how big of it. And if you've never seen an elk, you've got to at least go look
They're
at it.
huge.
Huge animals, and
Yes,
they
they
have
are.
big antlers.
Yes.
Yes, and it just amazes me. I've been elk hunting before. I have not got an elk yet, but it amazes me how you can communicate with them and the vocalizations and the bugle that it sounds. But how they can be such a big animal, but be so stealthy, even with big antlers and how big their body is, and go throughout the woods, and you wouldn't even know they could be right there beside you, and you wouldn't even know because that's their environment, that's their home, right? And so I just find it how amazing it is that they can traverse the landscape the way they can, how big they are, and those types of things. So I would want to be an elk. So.
But now there's a little bit of an oxymoron here. It's your favorite animal, but you're willing to go hunt it.
Yeah, that's true. Yeah. So, well, they
You might
also
have to rethink that.
I know, but they also taste good, so
Okay.
That is true. Elk does taste good.
Yeah,
I'll give you that.
can't go wrong with lean meat, so.
There you go.
True.
Well, again,
Good deal.
I do appreciate you guys coming on the podcast, and I look forward to this year's symposium, and make sure that Kathy said, make sure you get on and register right away. So I appreciate you guys being on. Thank you.
Thank you for the opportunity.
Thank you, Danny.
We'll see you
All right,
guys all
appreciate it.
in June.
Thank you for tuning in to the Indiana Athletic Trainers Association podcast. We appreciate you taking time to listen and look forward to you joining us again on the next episode. To find out more about the IATA or to get in touch with us, you can visit our website or reach out via social media.